Hi, I'm Mark Adams, Chief Medical Officer at El Camino Health. I'm here right outside our women's hospital in Mountain View. I wanted to take some time to talk to you a bit about what's happening with our maternal services, particularly in light of everything that's happening with the COVID-19 pandemic. So as we head toward the hospital, I want to introduce to you our Medical Director of Women's Services, who is Dr. Lisa Packard. Hey, Lisa.
Hi, good morning.
How are you?
Good to see you. Good.
So, Lisa, a lot of pregnant women, as far as I know, they have to deliver. They can't hold it in, right? And so, but a lot of worry, concern about, what should I do if I have to come to the hospital? Is the hospital contaminated? Is there a virus? What's happening? What can you tell us about that?
Thank you. So I think our staff and our physicians are really handling things quite well, and we feel very lucky here at El Camino to have a separate building for our patients and have separate entrances, and we're doing a lot for screening for our patients and providers as well, making sure that people who are coming into the hospital are healthy and well, and providing the same excellent care that we always have with our dedicated physicians and staff and anesthesiologists.
That's great. And you just said, I just realized too that this is a totally separate hospital, right?
That's right.
So patients coming here, if they're delivering a baby, they don't even have to go near the regular hospital, right?
Right. So patients that are being seen in the hospital for respiratory conditions or for COVID are being seen over in the emergency room, and our patients here have a separate entrance and a separate building that they're seen in and taken care of during their stay.
Oh, that's great. And so you said that, and people are being screened, right? Should we take a look and see how that works? Come on, let's go in. Good morning. Oh, wow. So right off the bat, we've got people here checking. We have security, and we're going to make sure that people that potentially have an infection are not going to go anywhere else. Is that right?
That's correct.
Okay. And so once people are screened and checked, that includes patients, visitors, and staff, right? Yeah, okay, great. And then we go up to the unit after that, if they pass. If they pass. Okay. Well,
just one note. If patients or their partners, staff that come with them, do screen positive for any of the screening questions or the temperature checks, we are recommending that they consult with their doctor. So they would wait before coming in. They should call their doctor and consult so that their doctor can assess the severity of their complaints and decide the timing of when they would need to come into the hospital to either labor and delivery or if they need to be screened for respiratory symptoms. So.
Okay, great. And because of all of the pandemic issue, we are limiting visitors to one.
That's right.
Per
one visitor
person.
Per person for their stay. Correct. As long as they're asymptomatic.
Okay. All right. Can we take a look on the unit? Okay, let's go. Okay, so labor and delivery is here.
Yep.
What happens at this point?
So then you're going to come into labor and delivery. If you've screened negative for your screening questions, you're going to proceed to the labor and delivery desk. If for some reason you maybe had a cough or other symptoms, you'll be met by the labor and delivery nurse here in the hallway and walked into the unit. So
Okay.
let's go ahead and go on in.
Let's take a look. Thank you. So for an OB emergency, there's still availability here, right, to be checked?
Correct. So we still have our OB triage area, which is for any complaints, including labor complaints, anything related to the baby or fetal movement or bleeding. You'd still come into the OB ED, which is a first assessment area.
And everything is being kept clean and spiffy at all times, as you can see, as we just saw. And then this is sort of the central area, right, where all the nurses.
Labor and delivery station, and this is where you check in when you come into labor and delivery. Then you'll be escorted to your room at that time.
So basically, everything is operational, right? Everything is going as usual, but with the added security and prevention, making sure that it's a clean, safe environment. Everyone potentially that might have an infection is separate from this area.
Exactly. I mean, our day continues just as any other day. Babies are still being born. Vaginal deliveries and C-sections are occurring in the same fashion, just with a little extra screening to make sure our patients and our staff are safe and protected in this time. But it's business as usual.
Great. And so every once in a while, we've been getting some calls that people are asking, should I have my baby at home because of worries? What's your answer to that?
So I definitely recommend coming into the hospital. We know the hospital is the safest place to have your baby, and we're doing all we can to protect you in this time. But still, the hospital is the safest place to have your baby. And if you have any concerns, you can also follow up with your primary obstetrician as well, who would, I believe, give you the same recommendations.
Okay. And by the way, at Los Gatos, there's also OB service, and while it is part of the main hospital, it is totally separate and also isolated as well, my understanding.
That's correct, yes. And I think another thing to just reassure patients that we still have our same staff and services available. We have our anesthesiologists who are dedicated to labor and delivery. We have our OB providers and our labor and delivery staff, which are different from the main house, the main hospital, so that we can continue to provide that care.
Okay. Well, thank you. Well, thanks so much, Dr. Packard. And hopefully this will help to answer some questions that people may have. And hopefully, we'll continue as we are through all of the pandemic crisis and make sure that we're delivering our babies the way we all want to have them. Thanks.